The British government has announced that every adult in the UK will be offered a first dose of COVID vaccine by the end of July. That's 1 month earlier than initially planned. Health Secretary Matt Hancock also said that cases of the South Africa variant are falling now in the UK. Well, to talk more about this, we're joined by Dr. Murthy Budhavarapu from the University Hospital in Coventry, and someone who's been working very hard since the pandemic began. Thank you so much, Doctor, for joining us. So the good news from the UK that variant cases are falling, especially the South Africa one. What can you tell us?
That is correct. I think obviously when as we all know, the UK variant, which is the Kent variant, is now the dominant viral infection in the UK. And when the threat of South African variant came through, again, it's the unknown. We do not know it causes more serious disease or more pathogenic, but we know that just as UK variant, it can be much more transmissible, and therefore there is there's a drive to contain it. So, as Matt Hancock announced today, the Health Secretary, it is quite impressive. I think the South African variant, they dealt with it by intense surge testing in those postcodes where it was first found. So they really snapped it right down. So all citizens under 16 years, over 16 years of age, were tested, were given kits to test it. So as soon as the South African variant was detected. So by focused surge testing, they've actually contained it. So at the end of 8th February, we had 200 infections, close to 175 SA variant, but now there are 300. So the rate of rise is not alarming at all. If you look at the UK variant, which is still the dominant infection. So the SA variant's daily returns are forming very, very minor part of it. So one can say that South African variant has been adequately contained.
And tell us about the vaccination program. It's been accelerated. In fact, the government even announcing that it plans to vaccinate all adults by July end.
I think it is a very impressive vaccination program. One has to be appreciative of this. So over 80% of all the 70s have been vaccinated. So as the next in the priority list is, and as the 75s, 70s, 65s, 60s. So the vaccination program has been very impressive. Of course, we must remember that the government has taken a very difficult, brave, and unknowable decision of distributing the first vaccines to get the most cover before the second doses can be given out. So that, there was a little bit of misgiving amongst the scientific community, but I think it looks as if it's going to be proved to be right. So about 17 million vaccinations have been had. About 600,000 have had their second vaccine as well. So the vaccination program is very impressive. So we know that the drop of infections, which is the dominant variant of UK variant, actual coronavirus infections, are coming down really, really impressively rapidly. But we know that majority of this is due to the lockdown restrictions themselves. The specific impact of vaccination on the drop of infections is something that we need to tease out. But there is early evidence that is the case, because if you look at the over 70s hospitalizations, they have actually over 80s deaths. They've actually come right down as compared to under 80s deaths, which means that over 80s mostly are the ones who have had vaccine over the last 12 weeks. So therefore, there is some evidence that vaccine is having some effect.
Right. In fact, Matt Hancock has said that early data shows reduction in transmission among people who've had the vaccine. So even with that one dose of the vaccine, it's reduced the transmission, given that UK is keeping a big gap between both the doses.
That can be surmised from it. Because remember, both the AstraZeneca and Pfizer in particular were returning 70 to 80% protection for the first dose and going up to 94, 96% for the second dose. And therefore, in a pandemic such as this and an epidemic such as this, trying to vaccinate people, vaccination returns of anything about 60% are quite satisfactory. So I think the JCVI, the Joint Committee on Vaccinations, have taken a very difficult, but I think what is proving to be a sensible decision.
And Dr. Murthy, what about, the question everyone's asking, what about the lockdown and restrictions? It's going to be very tricky when to lift it and whether it would be premature when you do lift it.
Well, it is a fine balance. I think the government are doing a good job on this occasion. We have all, it's well publicized that the UK government's response to the first peak and the easing of lockdown and a little bit of behavior around Christmas have got us into such difficulty. Our second peak has been, I'm a clinician, I'm in the intensive care units, and I've seen carnage. So therefore we know that. But on this occasion, certainly the authorities are doing absolutely the right thing. And as Matt Hancock just said, that the release of restrictions will be very carefully measured, staged, in a staged fashion, so that first of all, the primary school children are going to be able to go back to school on the 8th of March, but the second stage, people could wait a long time. So they want to bring down the expectations so that the people do not have a free-for-all, and we'll get into the situation that we were in December, January.
All right, Dr. Murthy, thank you so much for speaking
to
us here at NDTV.
Thank you.
Thank you.